Hi friends, welcome to Dr. Ram's Medical Coding Academy's free training sessions. Today we are going to discuss about the special senses. Before that, I'd appeal you to share this video to all of you know, especially to students who are preparing for this NEET exams. Definitely all these videos are going to be very useful for them. And for coders or for graduates who want to aspire to be like medical coders, please make a note of all these terms which I'm just literally spelling it out, and also watch the slide and please make a note out of them. Let me walk you to the special senses. Before that, we need to know what are the special senses. So we have like the sense of smell, which is olfaction, and for vision it is seeing, and for equilibrium it is like to maintain balance, and as gustatory. What is gustatory? The sense of taste. We call it as gustatory. And finally, to hear all of these, we say is auditory. So these are the special senses, of which today we are going to discuss about the ocular system and the auditory system. The ocular system consists of these eyes and its adnexa. The eye is in the form of a globe which is located within this orbital cavity, and the movement of the globe is being enabled by muscles called as the extraocular muscles. Extra refers to outside and oculus as eyes. In Latin, eyes are called as oculus. The globe is in the form of three layers, or we call it as the coats of the eye, which is nothing but the sclera, the choroid, and the retina. More anteriorly, we find a lens type of tissue called as cornea, which is needed for all these vision purpose. Apart from this, there is a mucous membrane covering that lines the globe of the eye, which we call it as the bulbar conjunctiva. When we talk about bulbar conjunctiva, there is something called as a tarsal conjunctiva. If I have to talk about the tarsus, then you need to know about the other structures. The eyes are guarded by the eyelids. The eyelids, these are 4 in number. The sense like the left upper, left lower, right upper and right lower, and they contain the eyelashes. The points at which these eyelids meet, we call it as canthus, and we have two canthi, the medial canthus and the lateral canthus. The conjunctiva lines its tarsus or the eyelid, and we call it as a tarsal conjunctiva, and that part which lines the globe of the eye, we call it as a bulbar conjunctiva. Posterior to cornea, we have the colored portion called as the iris. Iris, it is a membrane which contains a small hood at its center, and the center, it opens and closes because of the contraction of this iris muscles. This is what we call it as pupils. Posterior to this iris, we have the natural lens. The space between the cornea and the iris, we call it as the anterior chamber, and the space between the iris and the lens is a posterior chamber. And till the natural lens, we call it as the anterior compartment of the eye, and posterior to the lens, we call it as the posterior compartment of the eyes. Posterior to the lens, we have a jelly substance called as a vitreous, and that gives a shape to the globe of the eye. Now, how is this lens being kept in position? With the aid of ciliary muscles. And apart from that, we also have a structure called as trabecula, which helps in the drainage of these aqueous fluids. If there is any obstruction, it can result in elevated intraocular pressure. The retina is the innermost layer, and the sensory and the nervous layer. From there arises the optic nerve, which sends an impulse to the optic lobe of the brain. The retina is being filled with cones and rods, which are needed for color perception and for light. The auditory system can be classified as three, as the outer ear, middle ear and the inner ear. The outer ear consists of the spina and the external auditory canal. The middle layer, we call it as the tympanum. In between the tympanum and the external ear, we have this ear drum. The middle ear cavity can also be classified as the epitympanum, mesotympanum and hypotympanum. Hypotympanum communicates with the nasopharynx through a tube called as the eustachian tube. The middle ear cavity consists of the ear ossicles, malleus, incus and stapes. and these bones communicate with the internal ear through orifices called as windows, and these windows are called as fenestra ovalis and fenestra roundalis, or more simply we can call them as the oval window and the round window. The internal ear is made up of cochlea, which is the hearing portion of the ear, and you should understand that ear is not just an organ of hearing, but it is also an important organ for maintaining balance. Balance is being maintained by the semicircular canals and another common chamber called as vestibule, which consists of this utricle and the saccule. From the vestibule arises the vestibular nerve, and from the cochlea arises the cochlear nerve, which forms this vestibular cochlear nerve, and this is nothing but the eighth cranial nerve, which is the auditory nerve. Let's move on to the medical terms that are involved with both the special senses. First, to talk about these eyes, we can talk about the lids as blepharo or tarso. Then talking about this conjunctiva as conjunctivo and cornea as kerato. Iris as irido and ciliary body as cyclo. The lens is called as phaco, and the vitreous we call it as like vitreo, and retinal layer we call it as retino. While examining the eye, the doctors might document as perla and EOMI. Perla means pupils are equal, round and reactive to light and accommodation, and EOMI as extraocular muscles are intact. Now let's move on to the auditory portion, where the eardrum is called as meringo or a tympano. As discussed, the modular cavity is classified as epitympanum or the attic, and mesotympanum and the hypotympanum. The ENT doctor is called as an otorhinolaryngologist. Oto refers to ear, rhino refers to nose, and laryngo refers to larynx, and logi as study. Technically, it should be an otorhinopharyngologist. The eye is also called as oculus. The right eye we call it as oculus dextra, and the left eye as oculus sinistra. Let's move on to the pathological conditions that are associated with these systems. We have the refractive errors of the eyes called as short sight, long sight, and astigmatism. The short sight we call it as myopia, and long sight as hyperopia or hypermetropia. Strabismus is a condition we call it as squint, where there is too much of strengthening of these extraocular muscles, resulting in a cross eye. Retinoblastoma is a condition of a cancer that arises from the retinal layer of the eye. Glaucoma is a condition where there is elevated intraocular pressure, and that is because of obstruction of the flow of this aqueous humor, and this could be because of conditions like trabeculitis, or if there is any obstruction to the flow of this aqueous humor. Iridocyclitis is a condition in which there is inflammation of the iris and the ciliary body. Let's move on to the ear disorders. We call it as otitis media. Whenever there is inflammation of the ear, it is otitis. Now, if you are going to apply this to the external ear, we call it as otitis externa, and the middle ear as otitis media, and the internal ear as otitis interna. There is a condition called as otosclerosis, in which the stapes, it is going to adhere with this round window, and thereby the foot plate of the stapes is now getting calcified, and this could result in hardness of hearing. This condition is seen in the elderly, and we call it as otosclerosis. Meniere's disease is again a condition which is seen in the elderly, which is characterized by deafness, vertigo, and tinnitus. Tinnitus is an abnormal sound that is being heard by the patient subjectively. Let's see some surgical procedures. Conjunctivoplasty, which is repair of the conjunctiva. Canthotomy is the incision of the canthus. Keratomylovasis, kerato refers to cornea, and mylovasis as shaping. Mylovasis as shaping. So corneal shaping is being done for these refractive errors. Retinopexy, in conditions like detachment of retina, the surgeon can perform a retinopexy. Vitrectomy as a removal of this vitreous humor. Let's move on to the procedures that are done on the ear. We have like tympanostomy. Here there is an opening that is being made in the tympanic membrane of the eardrum so that they can drain the fluids in conditions like otitis media with effusion. We also call it as the ventilating tube. Mastoidectomy is the removal of this mastoid bone or the mastoid sinuses. Stapedectomy is the removal of the stapedius bone, and labyrinthectomy is the removal of the labyrinth, which is the internal ear. Coming to the coding aspect, the procedures that are being done on the special senses like this ear and adnexa and this auditory system, they're all classified as a H code in the ICD-10 CM. In the CPT manual, all these procedures of these special senses are included under the chapters as eye and adnexa and also as the auditory system, and all of these codes begin with the character 6, in the sense 60,000 series. Let me walk you through a coding scenario where Arun, who is a 60-year-old male patient, is having a nuclear cataract and he is scheduled for an extracapsular cataract surgery. We can report the diagnosis code as H25.12 and the procedure code as 66984 LT. The modifier LT denotes that the procedure is being done on the left side. And please ensure while selecting the codes like H series codes, you need to be careful in selecting the laterality, whether it is right or left or bilateral, or is it an unspecified site. I hope this session would have been very helpful to you all. Please keep watching all our videos and do let us know if you have any queries or questions. I'll see you in the next session. Till then, take care.
You can contact us at 805 60 855 96 9962 791072.